Welcome back. A section of healthcare workers' unions have urged the government to prioritize training institutions for healthcare workers in the planned reopening of the economy. Union leaders, among others, the Kenya National Union of Nurses and the Kenya Union of Clinical Officers, say this is necessary in safeguarding the health of Kenyans. They further urged the protection of health workers on the front line, adding 2 workers had succumbed to the virus. They also called for the extension of the term of the risk allowance to beyond the COVID-19 period. Well, let's now speak to the Kenya National Union of Nurses as Secretary General Seth Panyako joining us live here on News Desk. Many thanks for your time. As the country plans to reopen the economy, what are some of the key concerns of healthcare workers?
The key concerns of healthcare workers have been and remain the issues that we started raising once we had a confirmation of the first case of COVID-19 in Kenya. We were talking about protection of health workers, hiring of more health workers because we have serious acute shortage of health workers in Kenya. We were also talking about proper remuneration of those health workers. We now have a government that is employing health workers in different counties at different terms and conditions of service. And most of those terms and conditions of service are actually dubious. You saw in Mombasa, Governor Joho saying that he wants to employ health workers at diploma level, degree level, and pay them 15,000 shillings. We have seen in Busia, they are paying 25,000 shillings. Other counties are paying 15, others 20, others 21. Others are trying to come up with a non-existent postgraduate training, which they are calling as internship, which does not exist, and diploma and certificate programs especially for the nurses. And these issues have not been addressed by the government. We were talking about the health workers being given, frontline health workers getting a special package that is called Frontline Health Workers Welfare Package, which was accepted by the president and directed to ministry to work on the package. Surprisingly, the package was worked on without an input from the trade unions leaders, and what came out was not pleasant to us. But what's important to note about that package is that we complained about that package being arrived at without rating the level of exposure and the level of risk of health workers, because there is a scientific method that have been developed on how to gauge and to come up in terms of who is more at risk and who is at a lower risk and who is at the lowest risk. So we have those who are, when you keep a scale of 5, we have those whose risk is at 5, others at 4, others at 3, and others at 0. Probably we may not have any person in Kenya who is at 0 risk. So we rejected that, and we issued a 21-day strike notice. And immediately the government mobilized a ministry led by the Ministry of Labor and Social Protection to engage us. But what has happened so far, there has been any outcome of those negotiations. It has been only to buy time. We never told the government not to pay us the amount it had already offered. We want the government to pay what it has already offered as we continue to pursue negotiation on improvement of that COVID-19 welfare package for health workers.
Right. I mean, health workers, we've been saying, are at the front line of this pandemic. In April, we had the Health Cabinet Secretary Mutahi Kagwe say the government would hire an additional 6,000 health workers. 5,000 of those, he said, would be deployed to county health facilities. 1,000 of those would remain in national hospitals. Has that happened since?
We have not seen those health workers being hired, although I have received reports that a few have started trickling in different counties because different counties have different ability to hire. But as we are saying, we are yet to see the terms and conditions of service that these health workers are going to be subjected to. If those terms and conditions of service are not going to be in tandem with the schemes of service and respect the issue of equal pay for work of equal value, then we definitely are going to challenge that. 6,000 health workers are not enough. We need 10,000, a minimum of 10,000,
right, so
that we can have enough health workers.
And even as we speak of those 6,000 that are there, let's speak about the level of protection, them being on the front line of the COVID-19 pandemic. I mean, there is evidence in South Africa, several hospitals had to close because healthcare workers got infected with COVID-19. Here in Kenya, an isolation center for healthcare providers was set up at the Kenyatta National Hospital. But as of last month, that was the only one of its kind in the country. What is the situation in terms of the number of healthcare workers who have been infected and how they are being protected?
the number is now above 100. And as you are aware, we have now recorded 2 deaths, one in Nairobi and one in Kacheato. And we really sympathize and stand with the families that have lost these Kalan soldiers who have been on the forefront fighting the COVID-19. And the most disappointing thing is that they have died without getting enjoying the COVID-19 welfare package as had been directed by the president. The health workers are not properly protected. The problem why they do not have enough PPE, personal protective equipment, is because of the corruption which is going on in the Ministry of Health. You are aware that the other time we had officers in the ministry who are supplying air in terms of PPEs and actually getting millions from the COVID-19 kitty. And we are yet to see those employees being arraigned in court and being prosecuted. We are aware that the Ministry of Health is spending about 1 billion per day. We do not know what they're using that money for. And this haste of corruption going on in the Ministry of Health, if it is not going to be controlled, then our aim as a country to manage COVID-19 is not going to be possible. At Kenyatta National Hospital, the established quarantine or isolation facility for health workers has been overwhelmed. And last month, we received information that health workers who had been isolated in that facility were being forced to go back home, and they had not even been tested. So I think what is important is that we must take care of health workers. We must give them the support that is required. Those who are infected must be given a place to stay, including even hotels. That is not happening. We do not have adequate facilities to take care of health workers who are infected.
The welfare package that you speak of, there have been recommendations to perhaps extend that beyond the COVID-19 period, but we already have healthcare workers decrying failure of the counties to pay their salaries and their benefits for the past few months or so. Does this go back again to the conversation of perhaps having a health service commission, one that runs the affairs of healthcare workers in the country?
I can tell you for free that health care workers or health care becomes only essential in this country when we go on strike. But when we are not on strike, health is not an essential service. Any government that wants to succeed in economic development cannot leave health sector in the small politician at the county level. You see that Homa Bay has not paid salary as we are talking today. And I'm going to tell Homa Bay, if they don't pay salary for the month of June, by close of business tomorrow, next week there will be nobody working. We cannot work for 2 months without salary. So they must pay the salary for June and July before close of business, for June and May, before close of business tomorrow. If they don't do that next week, no one will be working. We are aware of Vihiga that has been on strike because of non-payment of salary on time. We are aware Busia has been on strike because of poor terms and condition of service. We must have a centralized system of managing human resource for health. And that is why we are saying the Health Service Commission will be the solution to these problems. We have never been going on strike on the issues of non-payment of salary when we were in the central government, though I'm not trying to say that the central government was doing either better than the county governments. What we need is to have a body that is responsible for managing and planning for health. The reason why we are not having so many problems with the teachers is that they have the Teacher Service Commission. And the function and the roles of the Teacher Service Commission is to ensure that there are enough teachers, they manage discipline in the teachers sector, in the education sector, to ensure that teachers are teaching and those who need support are being given support. And that is why, with a shortage of about 178,000 teachers, the Teacher Service Commission has come up with a clear plan on how many teachers should be employed per year in order to try to reduce that shortage within the education sector. But for health sector, we do not have a body that is responsible entirely for health. There's no budget. We cannot even talk of being a signatory to Abuja Declaration of 2000 when we do not have the Health Service Commission. How are we able to allocate 15% of the national budget to health when we have health being devolved to different counties that have got different priorities? So we stand and say that the Health Service Commission is a priority that we are fighting for, and if there will be any attempt to remove it from the PPI report, the moment we realize that it has been removed, we will stop working and we'll go to look for the Health Service Commission where it will have gone.
Many thanks for your time.